we're going to change tact a little bit and have a little bit of a panel discussion. So I'm sort of dying by PowerPoint presentations at the moment. But if I could get James, Neil and Gary to come up and we'll have a chat around the Monash Health project. There's no microphones, guys, so you have to speak very loudly, which Gary won't have any problem with. Yeah. Come down this end, Neil. Well, firstly, when you're welcome, the three of them onto the stage. Thank you. Maybe instead of me trying to introduce and not doing that for proper credit, maybe Neil, can you tell us a little bit about yourself and how you got yourself into this role?
I'll isolate on an old job. That's how I found out getting this role.
A restructure, was it?
It was a restructure, and I used to do procurement and supply chain amongst other things at the health service for about 8 years ago. And they said you're going to do engineering and all these other things, and right in the bottom it was highlighted, it said car parking. So I had no idea until that point, and it was after the change was adopted. So that's how I found out about car parking, and it's been a roller coaster.
Very good. And James, your role in the project and maybe a little bit about ACE?
So we inherited Neil after the org restructure. So the tender was quite a long process. It had already been out in the market for a couple of years before it actually got to where we are today. And there was a lot of legacy behind that, both emotionally within the organisations that have been dealing with it to get to where it was now and to get it to market so it was robust. And then the tender process probably took about a year from the day we got announced publicly to working through that tender process, being awarded, shortlisted, et cetera, and then actually going and breaking ground and getting it there. So it's one of the things that we look back on and say, it was actually the largest infrastructure project happening within parking in the last 5 to 10 years, and I'll argue with anyone about that because we're now sitting at just over 110 lanes, and we estimate we'll be sitting at 120 lanes by the end of this financial year. And
maybe just touch on that, James. I mean, how many campuses is it?
Which day?
7.
Which day is it?
7, Neil?
It's 7.
8?
7 large public hospitals, yeah.
Yeah, so 7 campuses. How many car park locations inside those 7 campuses? It's changed, that's why I'm asking. Anyway, 40? Thanks, Steve. Yeah, at least someone here's on the ball. 110 lanes going to 120.
Yep.
20,000 staff. 24,000 staff registered onto the platform.
250,000 transactions through UbiCollaborate a month. So targeting 3 million a year.
Great.
Sorry, not transactions, vehicle movements.
Vehicle movements. So it gets a bit of an idea, I suppose, of the scale of the project. Did you want to finish anything off while I cut you off there?
No, you should have perfectly.
No worries. And Gary, you had a bit of fun with this project?
Yeah, I haven't slept for a year and a half. But, I actually thought back. I think, so Gary, Commercial Director of Parkgate, was the tech provider, the hardware provider. I think I was late to this last year because I was finalising my Monash Health tender response. So there you go. But yeah, it's been an epic journey. We had been involved with ACE through another project just before this, but nothing to the scale of what we've got ourselves into here. I guess when we're looking at it, it didn't seem that complex. It was more about scale, but there's been so many moving parts and developments and I guess evolutions of both its solution and how we work together with ACE and Monash Health and UbiCollaborate over the time.
Yeah, well, maybe a little bit of snapshot. Obviously, Neil's the end client. James and Ace Parking led the tender bid, and it's an operator's tender. And then obviously Parkgate have supported with the IPP parking equipment. There was an existing solution at Victoria Heart Health, and then UbiPark's integrated the permit platform across the top for staff, contractors, retail staff. Am I missing anything, Steve? No. So that gives you a bit of a snapshot of the project. Neil, how does Monash Health go from, because I think you bought some new equipment within the last sort of 18 months to the old system. How does it go from making a decision on to do a project like this at the scale it was?
Slowly, like, like the cheese. So I think I was Chief Procurement Officer while the tender was going on, but we've done this tender probably 2 times in that time, and we've had 3 false starts to that in that time. So I've been actually across car park quite a while before actually becoming responsible for it. And I think part of that was just the organization not really understanding the complexity of car parking and what it would take to transition to something as big as this. For us, it was more a change management project. It's a big technology project, but it was staff changing the way they behave every day, and so there was some understanding of what they were trying to do. But I remember a critical point during the tender where I sat with my CFO saying, I don't think they quite understand what's going on. And I said, go stop. And I want all the bidders to come in and look at the car parks. And I think you guys took about 3 weeks to have a look at the car parks. And I look back now and I think that's probably the best thing I've ever done in the 10 years, almost 10 years at Monash, because a lot of what we put in that requirements document was actually wrong. Infrastructure, number of lanes, what appliances were there, what networking capability was there. We're still discovering a few more. Had we not done that, you would have not been able to price that project correctly, right? And then we would have ended off with a really poor relationship now versus what we have.
Yeah, I think we, prior to this tender, I think we walked the site with the last project manager, Stuart Shelley, about 7 times and got 7 different numbers, and no one would ever confirm the numbers of car parks and lanes, which made it completely tough to price.
I think that's one of the challenges, though, because it was so big. I can't stress that enough. That it was so spread out. You can walk 6 different ways through to the same car park, and you'll turn out, we were walking around for the 3rd time going, what's the name of this car park? Oh, I call it car park F. You call it maternity car park. Someone else calls it the SMS car park. What's SMS stand for? Like, there were just so many naming conventions, and you're looking at maps going, where are we? What building is that? And it's big.
Yeah. Neil, we'll go back to, because obviously you talked about the change management. So, part of that was moving staff from being charged on a roster, which could have been seen to be unfair in certain situations, because if they hadn't driven in that day, they were still being charged for parking, to a pay-as-you-go type of solution, and how I remember some of the key stakeholder engagement meetings early days around getting people onto their heads around that.
Yeah, look, the business modeling said that we would lose revenue if we did this. You probably know this, right? I've been there 9.5 years. And in all of that time, the only time I didn't pay for parking was actually put annual leave in. But through all of the time of COVID, I worked off-site for at least half of that time, and I never went back into payroll and said, I want some money back, right? In the end, we charge about $6 a day, and you sort of get used to just seeing it in your pay slip and you don't think about it. It's not a big amount for you to go claim it when you're 1 day away from work. But when you roll it all up, that's equivalent to maybe, I would say, coming close to $1.5 million that we're seeing in reality now as the drop in revenue. Or you could look at it as the value we've given back to staff, right? And that's how we choose to talk about it. Staff with, not working and still paying for car parking. But the other side of it is, if you worked 6 hours a day, you still paid for 8 hours. But if you worked 14 hours per day, you got paid for 14 hours a day, but you only got charged for 8 hours a day. So the change management was about saying you only pay for what you use, but if you work 14 hours, you also pay for your car parking for 14 hours. So when you look through all of the changes we made, most of it's positive. You know, the way you access the car park is positive, as long as the QR code works, or the license plate recognition works, or someone hasn't driven through the boom gate. But what sticks in people's heads is the fact that they pay a little bit more if they work longer. And this is something that we're just working through, right? Human nature, focus on the negative, and I think we've done probably 100 things right and improved staff access, visitor access, you know, the whole experience is better, but you can never win. This is what I take away from the last 6 months. People will still complain about the one thing that you didn't do that they think is right versus what you do.
Maybe fast track towards delivery. James, you're obviously, your team was project managing delivery of multiple vendors, not just Gary and I, and the teams behind us. You also had an existing supplier. You need to pull all this together. Tell us about how that was.
So we broke it down into 3 real segments. One was taking over the live existing systems straight away. So we had aging legacy equipment, much like Brett said. The system's already falling apart. Gaffer tape and WD-40, the Great Australian Toolkit to hold it together. And we've also got a company that's been in there for over 15 years. So they've been renewed, and know everybody. So you've not only got to unwind some of that, but you've also got to make sure the equipment worked. So one thing that we did was replace all the intercoms with Gary. Day one we walked on site, we replaced 30 or 40 intercoms, and we focused significantly on public.
You good 3 days notice, James?
Well, it's one day too many. And so making sure that the public revenue for the hospital is still coming in, but also not impacting patient experience as well. So our team obviously mucked in, we put the whole team on task, and we returned lanes to operation that had not previously worked for whatever reason. Rhyme, rule, complaint or excuse, we had every lane operating by the end of the month. There were some other things we had to do with working with the old company that was there, and then we had to re-audit the whole system and make sure we had every lane across all the sites calculated, represented back to the client, because we just weren't confident that the 80 or the 60 lanes that were in the tender were there. And as I said, we're now at 110 almost. So there was a big gap, and also the organisation's grown since award as it's kept expanding and picking up new car parks and making it fairer to those that need to be paying or haven't been paying, picking up those car parks that were not considered required to be in there. So that was taking over the live site for the system. And then it was also going through that procurement process with Gary and with Mostyn's team to make sure that we picked up everything we did, user journeys with UbiCollaborate for staff, making sure the public had the LPR, upgrade technology. Do we need entry stations? Well, yes, in a public environment, particularly public hospitals, they're not used to ticketless car parks yet. They don't have their credit card ready to tap on the way in because they might get validation on the way out. So there's too much confusion for them. We just need to simplify it, add back in entry stations so it's just that consistent journey. And then we realised that when we put LPR in, the exits just had no queuing. So now we've got too many exit lanes. We could have even dumbed down the exit lanes because the technology is making it that much more progressive for people. And then the bigger project, because it's 20,000+ staff, we had to go through this UbiCollaborate user experience and absolutely test everything and push everything. But what happens for the 1%ers? Normally we ignore the 1%ers because they're just 1%ers. But 1% of 24,000 staff members is a pain in the backside still. So we had to work through what those would look like, making sure we fleshed all of them out, and then put it through the pub test. And then we started trying to pick up some user experience sites and some trial sites. So we picked up some really unique satellite sites. One was a executive staff car park environment. And another one was going to be a temporary site that was going to last for about 2 years during our project anyway. It was already in existence and we just needed to upgrade that to have boom gates and trial it there. And thank goodness we did, because we learned so much as suppliers, as a management organisation, and also Monash Health learned about their staff members as well. So when Neil jests about the QR code not working, it's the same thing that they said before when they were tapping on this thing here. They're smashing the things with the phones. They don't know how to scan QR codes. We've just come out of COVID. How do you not know what a QR code is? It's a barcode. You just highlight it in front of the and they're tapping, they're touching their forehead. They've opened it up on their phone going, it's not reading. Can you show the barcode to the camera? Like everything and more. There was not a
What about the A3 page QR codes?
So some people were printing them out at home and they were bringing A4s and holding it out the window and
Ice water out for
yeah, selfie stick. And then Steve decided he was going to paste a QR code next on the side of his car. It was just so many things, and you know now the QR codes need to be 23mm by 23mm is the best one, or whatever that measurement.
A lot of learnings for all of us out of that. Gaz, just talking about, obviously we did the trial sites and some testing and stuff like that, but then come go live, talk about some of the changes you made on the fly.
Well, for anyone who's gone live on a car park, we went live on 32 car parks on the same day. We staff everywhere, from Monash Health to ACE to us, and I'm not the guy who you let touch the equipment, so I was standing there just directing traffic.
Getting on coffee.
We're like, yeah, trying. So what we worked out was, as James touched on, is the integration with Ubi and QR codes. We've got that at another 25, 30 sites around the country, and the API between Ubi Park and IP parking works really well, as does the license plate recognition. So moving all of these staff over who've been using their Siemens swipe card for so long, which is like, we'll train them how to use the QR code, everything will be fine. But we're going live in the middle of winter at 6 a.m. in Melbourne, where people's phones are at different brightnesses. As we said, we've got printed out QR codes that doesn't read. It's just people getting used to it. Within the first couple of days, we had a massive queue, like kilometre-long queues at Browns Road North. So the executive quick decision was made from these guys to give me a quick purchase order at 9 a.m. one day for 2 lanes of LPR to go on entries, and John, the boys from Arcade. Four? We got 2 in straight away. We got the entries in straight away. But we had to work with some partners and cable, get equipment down, install, and go live ready for literally 6 a.m. the next day. And we didn't have anything on site. So we got that to happen, and funnily enough, when we got down there, we're like, I can't believe we've got it in. But they just don't seem to be coming in by license plate recognition. They're still trying to use their QR. It's there and it looks like it should be working, but it's not. And then I got on to one of the guys who in Sydney who had been up until 10 p.m. the night before trying to get that to work. Thought that he got it working, and then I got on to him just before 7 a.m. and he said, I forgot to tick a box. And tick that box, and within that minute, the gate just starts bouncing. And the LPR kicked in. It was almost the fact that it wasn't properly set up that showed us the before and after of what this impact was. And then the cars just started streaming through. So there's been another massive project over the last couple of months to see how we can look through. And in fact, my business partner's out walking all the Monash sites now to get some infrastructure up and running. But that's going to be another positive news story about we're continuing to develop with Monash Health and ACE on these continued improvements. I just wanted to touch base on some of the complexities that James mentioned before about things changing as for every cycle. If you were to do a 100-lane airport or something like that, there's going to be developments, there's going to be extensions over time, and you're going to have new multi-deck car parks built and all this sort of stuff. You can imagine in 7 different hospital sites of a lot of small at-grade car parks, there's been development in lots of small sectors over 20 to 30 years. So there's no documentation. There's no plans on where things are. Everything was a discovery process, and we're still going through that. So where we'd assumed things, we've got Siemens readers everywhere, or no Ethernet everywhere anyway. So we're relying on things like 4G, which signal the beautiful thing. So we're going through these upgrades, these performance improvements as we go through each gen. It's been quite an experience.
I might ask one more question before we go to the audience and get some questions from there. But maybe for the three of you, starting with you, Neil, what are the biggest learnings you've taken out of the project? If we were doing this tomorrow, what would we do different?
I put in LPR for everyone, everywhere. And I think I've gone back to the original project group and said, why didn't you do this? Why? And the answer was cost. But the value that we get from it far exceeds that initial capital outlay. And I think this is where understanding the service you're trying to deliver is so critical. Self-satisfaction, consumer satisfaction should outweigh the $1 million that it's going to cost to put this in. But it wasn't a priority. Service was not the priority. It was access. And now when you think about it again, you think, well, I really should have understood what I'm trying to do. And so I think that if we were doing it again, we just start.
James? New partners or?
I definitely take the same partners together. We could not have done it without the Ace Parking team members that we've got. We've got a great team that have made it so easy. And when I say easy, it was still massively hard. That one day we went live with all those lanes. We had 80 staff across 7 sites. It was huge. We were there from 6 a.m. to, I think I finished that night, midnight, when Gary's team finally packed up their tools on that LPR site. So yeah, it was big. So probably just continue to encourage Neil to maybe just launch over a couple of days, not just go all live on one day for staff. That would have been really nice.
Can I just pick up on that? The difference is that you couldn't do it.
No, I remember the discussions.
That's also the uniqueness of public health is staff travel across sites. So in one site you're going to use LPR, the next site you're going to use a QR code, the next site's got nothing. You just could not do that, and we stressed about this for so long, and then we realized we had to do big bang on it.
Rip the Band-Aid off, Neil. Get it going.
Lots of hair on those legs.
Yeah, I think
Gary, you wouldn't do anything different, would you?
Look, one of the things we haven't touched on is, I guess, the political nature of hospitals. Making sure all staff were treated the same. That was the other thing with the Big Bang. We couldn't have different arrangements at different sites. Look, there's probably a lot of little things that I would like to do.
Yeah, probably you and I together on some of the integration obviously works really well in first parking sites, right? And we knew it was bulletproof.
Yeah.
But these use cases were a little bit different on us, weren't they?
Yeah, there were some assumptions that we thought, it's just a small extension to what we've already got. But then you find that there's a hard roadblock. And then you try and find a workaround. And we got there, but there's also a process where, maybe if we don't think, things get put on the back burner in a project this size, and you're putting out often the fire that's in front of you. And then when you get a question of why didn't you deal with this? Because it just kind of got moved in the priority list. It was always going to be there, but it just got kind of moved around. So I guess the time, the testing, we did extensive testing. Joe, I think, walked the site like 3 or 4 times testing every user group, every profile through every lane. Right, so we had to make sure that every user group who was allowed in that car park could get access. Every user that was not allowed access, they got refused entry. All of these things, testing out the exceptions, I would do more of. We made some assumptions on things like offline functionality and how that works in a fixed cable car park. How offline works is different when you've got 4G that's kind of flickering. These sort of things, when you just get kicked off a local tower because I don't know, Telstra just decided to do it in. You've got to re-establish connection, so that's a couple of minutes. Well, what happens there when you're trying to do live data between two systems that's going to charge someone? So these are all things that we've ironed out, and they're going to put us in good stead for a lot of projects moving forward. But there's some pretty tough learnings when there's...
I think adding offline testing to the UAT might be the first thing we'd add. But also I think from a communications point of view, I think we've just gone through some of the same challenges at SAN. And I think from now we're pretty robust around making sure the next project we do with the customer, the communication, the QR code readers that we're using at SAN, it's hard for the user to know where the QR code reader actually is. So having signage around here saying that's a QR code reader is what we picked up out of SAN, and I think Tony's already implemented some of that stuff there. But that were one of the things, not understanding that people were printing them out in A4 and expecting it to read. They couldn't get far enough back for the QR code to actually read. So at least we're aware of that stuff now, and you can start to educate people on how to use it. Once they get there and understand it and they've learnt that, it does get a lot easier. Yeah. Any questions? Jen?
Sticking on the communication side, with a change management being so great with that number of users and the nature of shift workers, etc. How did you share on how you did approach it, and any of the nuances someone else considering it? How you suggest they do, whether it's around time or the scale of the program or approaches messaging, etc.
Lots of people, good communications teams, good project managers, piles here as part of the project. So we had an army of people on this because we did recognize that this was going to be a people change. Moving from swipe to QR code, PAYG, having accounts, that you can access online, getting reports about your usage, how you query it. This was huge, and then training people. Train some more, but they still don't get it. Send as many emails as you want, and you still get 100 people turning up going, you got a new parking system, didn't know about it. So, I just think you cannot over-communicate on something like this. You have to be innovative. One of the things we did, we realized people weren't listening to us. So we ended up putting huge posters across the entire site, right? Just big A1 posters. And then we still realized we weren't getting enough traction because we could measure it based on registrations to the accounts. Right? We should have 26,000 staff registered, and I think we were sort of flattening out at around 8,000 staff. And we ended up starting to put big yellow panels across these posters saying so many days to go. And then we started getting more traction. And then we had to go and ring managers next, go and talk to your staff. We still have thousands of staff unregistered on day one. So I think you just have to accept that. You just have to keep going. You have to get creative. You have to think about, is your comms penetrating far enough? And if it's not, do something.
I think one of the biggest thing around the operation was them going from a pass card that didn't have a lot of business rules attached to it, so they could badge pretty much anywhere. There wasn't a lot of anti-pass back, security and program people into wherever they thought they should, sort of scenario. And then you're going to a system which has actually got those rules in it, and people are trying to do the same thing they were, and it's not working. It wasn't that, sometimes the tech not failing, it was that someone was able to do something, like drive in twice in an entry, in that sort of scenario.
And I think that the other part of that is we have co-ops and we had co-ops of people. I think we must be up to about 20 or 30 of those now. But in the past you could call a friend who gave you access and no one knew, right? And now we've got these fixed rules and people are coming up against a system that is now immovable and they've got nowhere to get around it. And that in itself is another set of change issues because now they're upset that they have no backdoor into the system.
Which I think you're starting to see at SAN, yeah. You got a question, Tony?
Yeah, just as Have you cut off the old system yet? The old SIM
It's completely went. It was a complete shut over one go.
Literally on that first day, the old system didn't work. We had to go with QR.
We're sort of going through a staged approach at SAM where we're doing groups.
Okay.
And Monash Health was, we're on the old equipment, and 6 a.m. the next morning we're not on the old equipment. We're on the new equipment and the new solution.
So we just turned off the CM.
Seven campuses, 24,000 staff.
So how did the unregistered staff get into the site?
So that's where our
Maybe Ace can answer that question. Where's Nick?
We're on site with umbrellas
Nat.
and everything from day one. It was a challenge, and so we had business rules worked out with Monash Health that we would try, when the time was right and they weren't banking up traffic, we'd have the conversation, we'd share the flyers, we'd give them flyers to download the app and register and all that kind of stuff, and let them in manually through our own access all area barcode. And then when the queues got too busy, we'd throw them a flyer and get them in and tell them to do it today or else. One of the other things that Neil forgot to mention with the comms package as well is because we were tracking how many had registered, we knew who hadn't registered because the old system still had that information through payroll. So SMSs were sent out just to those defined groups. So that SMS list also went from thousands down to hundreds very quickly. And I think that was probably one of the strongest click-through methodologies, was going to their phones, not their work phones, not their work email addresses, because they don't check because they're a ward staff member. They don't even check that, they just want to know when the Christmas party is. So they're not checking those emails and they are doing the SMSs on their phone.
I think one of the issues is that you have to be patient in the beginning, which means you're letting people through because they have registered, they haven't done the right thing, they forgot to bring the QR code. But you're also losing revenue. And this is a revenue center that is returning on capital that you've invested in these car parks. So actually you can't ignore this. And we actually get really tough at some point, but you got queues of people standing behind trying to get access, and you got one person who has registered. What do you do? Right? And it did take us a while to get that message across, but eventually I had to say no more, which means you're inconveniencing your own colleagues because you're going to have to back up. But we had to make that.
Paul?
Just as an indication, what was the time frame from day dot that you implemented the new system to as close to 100% saturation and take up by end users through Monash Health?
Well, firstly, we don't have the 24,000 100% usage. They've made the decision not to take up that opportunity.
Yeah.
We've also seen that since they're now PAYG, pay-as-you-go model, we've actually seen staff members not elect to park. So instead of going, I paid for parking, I'm driving in, I'm parking, now they're not coming in and parking, which has actually given us more capacity. And where most organisations have wait lists, we're not running a wait list. If you want parking, you register, you've got access to parking. We will get to a point as Monash grows as an organisation where that will become a flavour of conversations again in our catch-ups. But at the moment we've seen that drop-off utilisation, so it's actually a positive thing.
Within 5 months, there was probably maybe a 50% uptake from go live. So to go live with about 16,000 people, might be about 24,000 in 5 months. So people that thought that they shouldn't do it have now come on board. The ones that have got, this isn't too bad. Now, it's a pay-as-you-go system, maybe not like the old system, so they're now coming on board. So we've seen the numbers actually increase significantly in that from day one to where we are today. So that's within an unprecedented time period.
Maybe we should have got you on the panel, Steve. Yeah. Matt, we'll have one more question. We are over time. And
Given from staff, how has it impacted the concession? There's a black economy in hospital around follow-on tickets or concession. How has it helped solve that challenge?
I don't think it has. It's not been something that we were focused on addressing during that process. It has, as we rolled out the process, we've simplified some of those workflows, but it's still an offline process at this stage, which we hope over time we can digitize properly.
And I'd say we've, as new fresh eyes are coming to the situation, we've pushed back about a lot of it because we were getting orders from everybody. So we had to go through particular channels, and we've tried to simplify that as well, and pushing back, going, hang on a sec, how come that department's having that many tickets being issued? Because for me, trying to make things efficient, we shouldn't be printing out Bundy tickets and running around the hospital to 7 campuses and dropping off thousands of tickets every week. That's not efficient for us. That's ridiculous. So we're hoping to move to a more electronic platform where it's live and far more trackable, and then you've got logins about who in that department's taking those. Oh, why does Mary have 10 validations every day that just line up at the end of shift? So now we start knowing when the validations are happening as well, instead of seeing consistent, one validation every hour. Okay, well that's the people getting blood tests.
Might change if it hits Mary's budget as well, and it's accounted against that department. I'd like to thank Neil, James and Gary for a very insightful panel.